Your water is not clean. Every year in the United States, 12,000 cancer cases and $1.5 billion in healthcare costs are caused by nitrates alone. The same nitrates present in the water of 60 million Americans, and that's a single contaminant of hundreds. The water serving the tap here in Pittsburgh has at least these 12 contaminants at between 4 times and 500 times proposed safety guidelines. And Pittsburgh is not an outlier. Our water isn't clean because the legal limits are not the same as the safe limits. Federal regulations haven't been updated in 20 years, so hundreds of dangerous contaminants and thousands of latent pharmaceuticals exist in US water supplies with no legal limits at all. Even if you believe the limits are fine, our water is still at risk. I'm sure you're all aware here in Pittsburgh of the recent lead pipeline replacement, and we're all glad the city is doing something, but this was a problem long before it came to our attention in 2016, and it won't be fixed until at least 2026, all the while putting our water health at risk. And again here, Pittsburgh is not alone. The entire country will be dealing with this problem for decades to come. 93% of Americans worry about the pollution of their water, so why do so few of us treat the water that enters our home? It's because the industry has focused on transactional unit sales and ignored the user experience. Faced with purchase frictions, difficulty of use, and no value-affirming feedback from the devices on the market, customers opt to keep the water they have or they just purchase their water in bottles. There's a huge segment of customers that aren't being serviced by the market. We've created a new solution to this problem, a better one that makes it incredibly easy to treat your water and to track its quality. In an all-in-one appliance that's adapted to your water supply that's easy to use, highly effective, and provides continuous monitoring so you always know your water is safe. We're building a truly user-centered appliance with engineered hardware that's easy to use, maintain, and install with a 20-year life. Software that brings data on quality, local conditions, and system status to the fingertips of the user. And the industry's most robust sensors and controls package with advanced sensing technology that gives you confidence in the safety of your water. There's not another single product in the market that can give you that confidence. Between bottled water that's often cumbersome, wasteful, and serves the same tap water with added microplastics, to large custom bespoke home treatment plants that are $8,000 installations, there's a giant gap in the market for easy, effective, connected technology. And we can provide those benefits at a competitive price point. We'll generate revenue through appliance sales and through subscription service for filter replacements, dashboard access, and periodic testing. There's already a highly successful analog in an adjacent market for this model with Molecule, producers of in-room mobile air filters. With an equivalent price point and a similar value proposition, they generated $145 million in revenue last year. And we're generating our own traction. We had 10 users sign up as our alpha trial users, and they each paid a $40 pre-order fee for the privilege of purchasing a unit at full price when the trial commences in the fall. We also ran a survey with 500 of our target customers, 78% of which expressed interest in the product. More importantly, 36% expressed interest when presented with our current price point. And we all know that survey results don't directly translate to sales, but these early results are promising. Our target market is at the intersection of middle to upper income owner-occupied homes and those that regularly spend money on complementary health services and products. That's 7 million households, which translates to 15 billion in unit sales. It seems like a really big number until we consider that last year in the US, we spent $19 billion on just the bottled water we drank in our own homes. Through our entry customer niches, we're targeting 215,000 units over 5 years. Those customers come from 2 places. The first is functional medicine, an area where customers are already highly in tuned to long-term harms and where general water treatment is already a common recommendation without a go-to source. The digital transformation of the healthcare industry has given doctors access to patients in new ways through websites, portals, telemedicine, and email. And if there's a doctor in that space that's already going to recommend water treatment, we want them to recommend Castle. The second is through the technology and health consumer. This customer always wants the newest connected gadget. And if that gadget can improve their air, food, water, or health, they're eager buyers. We're going to reach them through digital marketing, social media advertising, and influencer campaigns to drive viral growth. Keeping control of a highly premium customer experience is incredibly important for the success of this product, so it's a clear direct-to-consumer play. Advertising campaigns, referrals, and affiliates will push traffic to our website where customers can quickly specify a unit, get feedback on and schedule installation, and order shipped directly to their homes. But we're looking at other avenues, including through home builders and co-branding with other smart home health products that can maintain or improve the user experience. We currently have a workbench prototype that we're using to test filtration, sensors, controls, and connectivity. And next month, we're starting on our customer-facing presentation prototype. Our alpha trial launches in the fall, and that'll inform our 2023 regional beta, where we're targeting 1,000+ units. That beta will lead into growth of 20,000 unit launch, multi-regionally or nationally, with an eventual sales goal in 2027 of 100,000 units per year. That growth path drives our phased product roadmap. There's a lot here, but the important takeaway is down here. At the 1,000 unit level, we can reach positive gross margins before factoring subscription revenue. And that margin grows significantly with scale. We're building a team that's passionate about water health and with the skills to bring this product to market. With a decade of premium product design, manufacturing operations, and technology development experience. We are an early stage, and besides our trial fees, pre-revenue company, so our team is small, but we are looking for additional co-founders and early employees, and we're flanked by a team of experienced advisors in entrepreneurship, water industry innovation, and functional medicine. We're seeking $520,000 to continue product development, discovery, run our alpha trial in the fall, and to run our pre-order and marketing campaign for our 2023 launch. Of that, we have $80,000 committed, and we need your help to empower every person with the knowledge that their water is safe. We welcome any contact for funding and partnership opportunities and employee or founder inquiries. Thank you. Let's go to some questions.
So in terms of your IP, is it sort of the standard stuff that's been on the market, like activated carbon, reverse osmosis, et cetera, or do you have something special?
The quick answer to that is yes. Our strategy is to avoid as much technical risk as possible. So we're not coming out with some brand new filtration technology that's going to take us years to develop. Our IP and our trade secrets is all built into how we package it together in a system and how we do that very inexpensively.
Is it the filtration that results in, is it better filtration, or is it simply, and I'm not trying to diminish what you're doing, is it simply the packaging, the monitoring, and the whole package?
Correct. The packaging monitoring is the main thing. Now, for reference, a typical point of entry water filter is going to be one big, giant, granulated activated carbon tank, and I won't get into how disappointed I am in those systems. We use a 5-cartridge system so that I can adapt modularly our filters to your specific water supply, and we also use UV light at the end of that. So we have a much more robust system, even though it's not using some really new technology.
Okay.
Yes?
Do you do the entire house, or you do a spigot?
Yes. This is a point of entry water treatment system, and this is probably a good point for me to show what a rough rendering of what that would look like as an install. Okay, so this would generally go where your water enters your house. Up here in the north, a lot of times that's right next to your water heater. In the south, on the outside of the house. But this is a simple bypass valve install with flexible lines that connect the unit, and then you're set up and ready to go.
You mentioned that you're working on the prototype. Can you give us an indication of exactly where you stand with that? Do you have it working? Have you proven that it can work? Is it just a question of making it manufacturable or scalable? Where does it stand?
Yes, so our current workbench prototype is effectively a bunch of filters and off-the-shelf components put together with a lot of sensors that we're testing, with a Raspberry Pi that we have connected to a low-sant dashboard so we can get our information out into the cloud. And that's the biggest thing. How do we put this package together effectively so we can get it out into the cloud? Our presentation prototype on the next level is going to be a whole bunch of rapid manufactured or 3D printed components that takes that package, puts it into a nice small package so we can put it in front of customers and say, this is what it looks like, this is how it operates, functionally this is how it works. We do have some prototyping as well with 3D printed components on the functional use of the product because we've made it a little bit easier to use so we could test it with customers, but nothing that we could actually put into a water system at this point.
Is this a whole house solution or just intended for a specific, the sink in the kitchen or something like that?
Yes, sir. This would be a whole house solution.
And how physically big is that you showed?
Our unit is approximately 2 cubic feet. It's about 24 inches wide, 30 inches tall, and 14 inches deep, which puts it's quite a bit less cumbersome than a lot of the same systems on the market that have the same functionality. And this is probably a great point to show that. So this is direct point of entry competitive comparison. And this is an actual size comparison between our units and theirs, right? So our unit over here has at least all of the features in these other systems, plus more, plus the monitoring in a compact package.
But do you have to reverse flush it more often, therefore?
No. So we follow a filter cartridge replacement model. And the reason for that is large granulated carbon tanks that people put at your house, the instruction manual literally says, replace media every 5 years. It doesn't account for your contamination, it doesn't account for your flow rates. Granulated carbon has a channeling problem to where it becomes less effective over time, and it also grows bacteria. So they have to put a lot of chemicals and zinc and copper in the material to make sure it doesn't grow bacteria. It's not a model we want to follow.
Do you recruit homeowners and then refer to installers, or do you have certain installers that sell for you?
Our install pathway, we're trying to avoid what happens now, which is everything is sold through reseller distribution. Installation is a highly cumbersome, highly expensive process. You install $2,000 worth of equipment for $4,000 of installation. We've made our product really easy to install. So a DIY homeowner who's done plumbing before can definitely do it in under an hour, but we're under no illusions. Most of the market will not do that. But making it easy to install means we can have other people install it very easily and cheaply, and the only state in the country we're aware of that requires a licensed plumber for that sort of service is Massachusetts. So everywhere else, we can use services like TaskRabbit and other networks that already have categories for skilled hardware technicians.
Can you talk about the data? What data you initially want to collect, what you want to do with it? Do you want to just sell it to me, the homeowner, or do you want to put it on a neighborhood watch thing like Ring does, or what are you thinking of?
So let's talk about a little quick use case here. Basically what happens when you get a boil notice, if you don't have water treatment, you don't shower for 3 days and you go buy bottled water. If you do have water treatment, you don't shower for a few days, you go buy bottled water because you hope your system works, but nobody tells you that it works because it's a big liability for them to say that because it's just a big tank of carbon, right? This is what we do. We know what's happening with the boil notice. We know what contaminants might be in it in your area. We know what your system is capable of. We can tell what your system can treat. Not only can we do that, we can modulate your flow rate so you get more bed contact time so you can treat more. So you have a much higher chance of not having to do anything during that boil notice. And then sometimes you won't be able to treat, and we'll give you options for what you want the system to do when you do that. And then all that data will go into making our systems better over time.
Quickly, did I see that your cost of goods sold on your 10 units for your Alpha was $12,000? And what are you trying to accomplish with the Alpha?
You saw correctly. It's a $12,000 cost of goods sold on the Alpha because it's limited manufacture of only 10 units. We're doing that in 8 different states, and we're testing that, number one, for the customer experience. How do we deliver the unit? How do we install it? How do they use it? How well does it work? How much do they appreciate the value? And the other part is to make sure that we have installations in different regions so we know how to deal with those regions, the regulatory authorities, and the house structures and layouts in those regions.
James is part of our online hybrid MBA program, and